Pregnancy is about nurturing a new life. Mothers protect their babies at all costs.
Right here.
But sometimes the tables can turn.
I was afraid when I put my hand up under her left rib cage. Frances was the proverbial time bomb.
God, it's huge.
Meet a mother in danger and the unborn baby who saves her life. Next, on birthday. In the early morning hours, Frances Walker Leslie and her husband Lawrence arrive at St. John's Mercy Medical Center in St. Louis. Frances is 37 weeks pregnant with their fourth child. 2 days ago, during a routine ultrasound, doctors discovered a large cyst on Frances's left ovary.
It's not quite up here, that's for sure.
Yeah.
Unable to tell if the cyst is cancerous, doctors fear it could burst with the strain of a vaginal birth.
Frances Walker Leslie was supposed to be here at 5:45.
If the cyst is malignant, rupturing it could cause the cancer to spread. The baby must be delivered today by cesarean section.
So I'm kind of nervous about, how everything's going to go, but the Lord will be with us and it'll be all right.
Just go ahead and put this gown on, opening in the back, and take everything else off.
The pregnancy has been a little topsy-turvy. We had a few scares. I've just been very closely watched.
Frances has been full of surprises for us this pregnancy. At the very beginning of her pregnancy, she had a little bit of a high blood pressure. Early in pregnancy, when you see blood pressures that are greater than 140/90, you have to suspect that there might be some chronic high blood pressure or chronic hypertension.
How you feeling today?
Fine. Anxious.
I'm going to have you raise your gown a little bit so I can tie this around your stomach.
Chronic high blood pressure greatly increases the risk of developing preeclampsia. Affecting 5% of all pregnancies, this rapidly progressive condition causes swelling, which can prevent the placenta from getting enough blood. This can cut off the oxygen and nutrient supply to the fetus.
I'm putting your baby on the monitor right now, so it's just going to monitor your baby's heart rate.
Okay.
Turn it up a little bit so we can hear. You know what you're having?
A little girl.
You got names picked out?
Her name's going to be Jalen Alexis.
2 days ago, when Frances went in to check on the status of the baby and make sure that her baby was doing well, the ultrasonographer called me, the maternal fetal medicine specialist called me and said, we saw something unusual, Dr. Knight. There's a cyst on mom's ovary. It's about a little over 4 inches. He said, I also checked blood flows in the cyst, and the resistance is low. Low resistance in a cyst is not a reassuring sign. In fact, many malignancies have low resistance to blood flow, so that's a bit concerning.
Yeah, I think I was kind of numb when they first told me. The doctor was a little bit concerned about it being malignant.
Bring some good veins with you?
I sure hope so.
I hope so too.
The plan was for her to go see the gynecologic oncologist for a consult. However, in the interim, Frances started having more labile blood pressures. Her blood pressures, which had been well controlled by the medicine we started early in her pregnancy, started to become more elevated.
Tests revealed Frances has developed preeclampsia. The only real cure for the condition is delivery.
So given that she's 37 weeks, which is considered term, has a large ovarian cyst, and now mild preeclampsia, it's time to get out. It's time for the baby to be born.
This is so strange. No labor, no contractions.
Are you all right now?
Well, not like I'm actually going into labor like I normally do. There's no pain.
The labor and delivery floor is nothing new to Lawrence and Frances. They have 3 children.
Our 13-year-old has Down syndrome. He knows that we're going to have a new baby. He's excited about meeting her. Then we also have a 7-year-old daughter. She's going to have a sister. So she can't wait because she's stuck in between 2 boys. She wants the baby to go to ballet class with her. The 5-year-old, also a boy, he's the most anxious of all 3 of them. All my pregnancies have been completely normal, completely routine. They've all been full-term 40 or plus weeks. vaginal births, no medication or anything, no complications. So this one has been different.
So with feelings of both joy and anxiety, Lawrence and Frances prepare to meet the newest addition to their family.
So which side was the cyst on?
It was right up here.
But before she's prepared for surgery, Frances is given an ultrasound to check the position of the cyst.
So this is the cyst.
That looks bigger. Doesn't that look bigger than what we saw yesterday?
I couldn't even tell.
This is the ovarian cyst, which is the reason that we are doing the C-section, because we're going to be removing it. Our plan is to perform a cesarean, and after delivery of the baby and the patient is stable, to go ahead and look at the cyst.
Now, can it move? Because you all are still looking for it. Would it like move, or would it?
Well, after we remove the baby, the cyst will move back into the pelvis, because it's kind of getting displaced by the uterus right now.
Okay.
But after that,
And it just comes back down,
right.
and then you are
The
remove
plan
it.
was to remove the cyst,
Right.
correct?
Yes.
The things that are at stake here are, at worst case scenario, that this is a malignancy, and we will have to do staging for a cancer of the ovary. And that will include doing hysterectomy, that will include doing lymphadenectomy or taking out the lymph nodes. Best case scenario, we will remove a very large cyst and prevent it from breaking and causing her discomfort, even if it's not a cancer, because when there's a large cyst and it breaks, it causes excruciating pain just from the irritation from the fluid in the peritoneal cavity or in the abdomen.
I'm ready to have the baby because there was a big concern for her well-being. And now it's kind of switched over to my well-being, but of course as a parent you're more concerned about your child first, so I figure as long as she's okay, then everything else will go okay too.